to the sixth. Oops, okay, great. Good. I welcome you to the sixth Dockside Chat, sponsored by the Carteret County Democratic Party, and the second series on water quality. Tonight we focus on drinking water quality. My name is Susan Shore. I'm a retiree living in Morehead City and a volunteer with the Carteret Democrats. Let me thank other volunteers who've made the Dockside Chat a reality. Katie Tomberlin, the chair of the Carteret County Democratic Party, Maria Zempel, Amy Voorhees, Lucy Bond, and Wendy Boss. Drinking water quality is a hot topic. We have all heard and read horror stories about polluted and tainted water. In my home state of Pennsylvania, where there continues to be a lot of fracking, there are homes with so much free gas in the tap water that you can set it on fire. They have to haul water in even to bathe. The problems, distress, and expense that poor drinking water can lead to are legendary. So I'm really looking forward to hearing an expanded and then locally focused view on the issue from our guests, who I will introduce in the order in which they will speak. Lee Ferguson is an associate professor of civil and environmental engineering at Duke University. Lisa Smith Perri is the general manager of the West Carteret Water Corporation. Patrick Kelly is the spokesperson for the citizens organization Carteret County for Public Water. A hearty welcome to all of you. All participants will be muted during the presentation. We will unmute you for 2 minutes at the end of the chat for goodbyes. If you have questions, and I hope you do, please add your questions to the chat box, and Lucy Bond will sort and collate them for us at the end of the program. We're going to begin with Professor Lee Ferguson. Lee, internationally, I know you work internationally, is it even possible to say what percentage of the world has access to clean, safe water?
Wow. Well, thank you for having me, first of all. I'm really excited to talk to you guys about something I care a lot about, and that's drinking water quality. When it comes to safe drinking water, certainly there are challenges all over the world and here at home. So internationally, in terms of how many people have access to safe drinking water, I don't have a number for you, but I can tell you that it really varies along socioeconomic lines and the dividing lines between the developed world and the developing world. And so we consider the challenges that we have in drinking water quality and drinking water safety. I think a lot of us take for granted here in a place like the United States that we can turn on our tap and have a safe product that we can rely on to bathe, to drink, to cook with, and to use for cleaning. There's a lot of places in the world where that's just not the case. And there's a lot of places in the United States even, surprisingly, where that may not be the case. As was said, I'm a professor of environmental science and engineering, and I've really made my career focus around how do we ensure that water is safe to use? Simple question, not so simple to answer.
Right, exactly. Would you tell us a little bit about your international work?
Sure. Because water quality is an issue that spans across political boundaries, I've worked on a number of issues related to both ambient water quality, environmental water quality, as well as drinking water. So some notable examples, we have studied the transport and occurrence of pollutants in shipping ballast water and how ships may actually transport contaminants from port to port along with their cargo just due to ballast water transport. And while that doesn't always necessarily have a lot to do with drinking water, it has a lot of impacts potentially on harbors and water quality in coastal areas. More recently, we've actually started an investigation in the nation of Sri Lanka, where there has been trouble over the years that's been noticed in the populations that live in certain areas of the country are experiencing chronic kidney disease that is unexplained. So it's not genetically linked. It doesn't seem to be related to food. It doesn't seem to be related to really anything other than perhaps a link to the drinking water in the areas. And so what we've done is started preliminary work to examine the wells that the people in these communities are drinking from, and to try to identify risk factors and contaminants that might be associated with the incidence of kidney disease. We have some indications that this is actually linked to pesticides, and in particular, a pesticide that probably most of you are familiar with. Who here has ever used Roundup? Anyone? Yeah, I see some hands. Okay, that's glyphosate. And so glyphosate is a very common, it's actually the most commonly used herbicide in the world. And there's some indication that it may have some interactions that cause or at least contribute to kidney disease. So we're doing some epidemiological work. I was actually supposed to have been in Sri Lanka for the last month, collecting samples from communities that are impacted by this disease. But unfortunately, with the COVID shutdowns, we've had to put those plans on hold.
Well, thank you. That's really fascinating. I'll try not to use Roundup anymore for sure. You mentioned that drinking water quality is uneven throughout the United States. Would you care to expand a little bit on that?
Sure, absolutely. There are so many aspects to water. And I think that many of us take for granted the ubiquity of drinking water and the ability to get it as sort of a cheap and readily available resource. What people don't necessarily always understand is the provenance of their drinking water. Where does your water come from? So if you live in a town or a municipality, in many cases, there is a local government-run or municipal-run water treatment plant, which is taking ambient water and treating it in order to make it safe for you to drink. And so the challenges that are associated with that include removing pathogens so that you don't get sick from your water with diseases. It also includes removing things like odor and taste that you don't want to have in your water. And then finally, something that's actually really become a hot button issue is removing chemical contaminants. In some cases, it can be hard to even know that they're present because you certainly can't see them, you can't taste them, and only very sophisticated analytical chemistry in certain cases can detect it. And so where is this a problem? Well, it turns out it's a problem all across the country, and it really depends on what is upstream from your water source. And what people don't necessarily realize is that in many parts of the United States, together with across the world, we practice what is essentially indirect potable reuse. And what that means is that most of us live downstream from someone's sewage effluent. So water, nothing magical happens to wastewater once it enters a river. If you then put a drinking water intake downstream from the wastewater outfall, you are in effect drinking someone else's waste. So now, of course, we've learned quite a lot in public health over the years about how to do that in a way that doesn't cause disease. But what is a real challenge is to remove what we term micropollutants and other kinds of chemical contaminants that are poorly removed in the wastewater treatment and then also turn out to be poorly removed in the drinking water treatment. Where is this a problem? Mostly it's a problem when we use surface water for drinking water sources. Here in North Carolina, there's been a number of high-profile problems with this in the Cape Fear River. And if I have time, I'll mention a few cases. The Gen-X. Who here has ever heard of Gen-X? Yeah, okay. So this is a class of perfluorinated chemicals that was discharged by the Chemours Corporation in Fayetteville and contaminated Wilmington's drinking water without anyone knowing anything about it for at least 20 years. So once we kind of got a handle on this, it's led to quite a lot of work and quite a lot of effort to remove those compounds and to make the water basically devoid of those compounds again. So that's one issue. The other issue that I would just want to touch on is that there is a real problem in this country of socioeconomic divisions and racial disparities with respect to clean water. And we just published a paper on this just last month with a case study here in the Research Triangle area. So there are cases around the country where disadvantaged and lower socioeconomic communities are basically disconnected or non-connected to municipal services. So basically the municipal water and sewer infrastructure has grown around the community, but they never got connected. And so those people are relying on what actually many of us that live in rural areas rely on for water and sewer, that is wells and septic systems. And so that's fine, but when you have a concentrated population where the houses are very close to each other, and you have to both dispose of your wastewater through a septic tank and drill a well in close proximity, it doesn't, take much of a leap of imagination to consider the problems that can cause when you have infiltration of septic leachate into your drinking water source. This can be alleviated by connection to municipal services. And so that unfortunately, lower income, lower socioeconomic, and in many cases racially sort of disadvantaged areas tend to have a higher incidence of this type of drinking water problem. So there's these issues of basically contaminants entering our drinking water system from a variety of sources, and it can sometimes be difficult to detect this without some pretty sophisticated analytical intervention. And it is so this is sorely needed. And we've just the last thing I guess I'll say on that is our state has actually invested quite a lot of money in the last couple of years to map out at least the perfluorinated chemical occurrence in drinking water sources all across the state of North Carolina. And we've been on the vanguard of that effort.
Wonderful, very good. And how do you feel, what kind of a grade would you give North Carolina in general at this moment?
For water quality or for their efforts to address water quality?
For water quality.
Okay. I mean, by and large, I would certainly say that the municipal and sort of city and county level water systems are all working well within the Safe Drinking Water Act. So they're certainly complying with the regulations set forth by the Safe Drinking Water Act of the federal. And so what that means is that we are not having incidences with high occurrence of things like Legionnaire's disease, or we don't have the issues in North Carolina, at least that I know of, that you saw in Flint, Michigan, where there was high lead concentrations in the drinking water. Where North Carolina has challenges is in what we term unregulated drinking water contaminants. And this is a case where the municipalities may be doing everything by the book. They may be doing everything that they're required to do to comply with the Safe Drinking Water Act. But the problem is that legislation does not address some of the emerging pollutants like PFAS, like Gen X, which occur in the drinking water sources. So they're not monitoring for them, and they're not treating necessarily in a way to remove them. Now, that's not true all across the state. So, for example, I'll give the example of the Cape Fear Public Utility Agency, as well as Brunswick Water, New Brunswick Water. They have instituted treatment technologies to try to bring down the concentrations of Gen X and the other perfluorinated chemicals, not because it's going to be required through the Safe Drinking Water Act, but because there is concern over exposure of these compounds. Okay, so I think what I would say is that North Carolina faces challenges for drinking water quality from the standpoint of chemical pollution, but that by and large, the municipalities and the state government is doing their due diligence to try everything they can to ameliorate this.
Very good, thank you. We have so many very extreme storms in North Carolina. We just had one a moment ago. Even without the hurricanes, which are their own case, what impact do these storms have on water quality, and how could it impact the drinking water?
Sure, that's such an interesting point, and it's actually something we have been studying recently. When Hurricane Florence hit, this was the source of so much misery in eastern North Carolina, and so I own a house in Beaufort, and it hit me close to home as well. And so as soon as the storm abated, I jumped in my car, grabbed my research assistant, and loaded up a bunch of sampling bottles. And we basically drove down the Neuse River and sent another team down the Cape Fear River as far as they could go, taking water samples to try to get at this question. And what we found is that there's two factors at play here. When big storms hit, there's a lot of water that gets dumped. And so that water is, of course, coming from the sky, and most of it's clean. So there's a lot of dilution. So you have a huge amount of dilution, and this is helping to reduce concentrations of compounds that might be running off from, say, agricultural fields or from, normal runoff areas. Okay. So but then we see a shift, so that when we have such extreme storm events, there are areas of our state and of the infrastructure that are flooded, which rarely see that kind of water infiltration. So in other words, we get flooding of, for example, concentrated animal feedlot operations, right? That's been in the news quite a lot. We also get flooding of wastewater treatment plants. And so what most people don't really consider is that if you build a sewer plant, where do you want to put that sewer plant? You want to put that sewer plant at the lowest point in your community because, well, water and other things run downhill, right? So you're going to put that plant close to sea level, or at least close to the level of an ambient water. And you're going to put it close to the water because you want to be able to dispose of the treated wastewater. Now, what we found happened in the case of Hurricane Florence, and again in Dorian and others, is that when the Neuse River and other large rivers, the Trent River, for example, when they overtop their banks, oftentimes they also flood the wastewater treatment plants that are adjacent. And so what happened in the case of Johnston County that we're able to detect is that the Neuse River overtopped the bounds, flooded the settling ponds, and basically flushed out the entire activated sludge settling pond into the river. And so we were able to detect compounds that we rarely ever see in rivers. We usually see these only in wastewater treatment plants, and we were able to detect them in the main stem of the Neuse River just following Hurricane Florence. And so in terms of water quality challenges, it's both an issue of quantity as well as the compounds and the other pollutants that may be mobilized from areas that don't usually see floodwater.
That's very interesting. May we assume that sea level rise from global warming will create the same kinds of problems?
Well, it's certainly going to cause some problems. I think for sea level rise, especially in North Carolina, what we're going to see is a different kind of challenge when it comes to drinking water sources. So for a good example is along the coast, most of the areas actually of North Carolina use groundwater as a source of drinking water. The municipalities, the counties, et cetera. There are some exceptions. The Cape Fear River area, obviously they use the Cape Fear River. But if you imagine cases where, for example, the relatively shallow aquifers that are along the coast, the Castle Hayne aquifers and other aquifers like that, as sea level rise happens, the seawater starts to infiltrate into some of these aquifers. And especially if the aquifers are being drawn heavily for either agricultural or for drinking water use, you have the concern that the saltwater intrusion will actually make its way all the way to the wellheads. And in that case, you will see what's happened actually in other areas of the world. What happens is the wells go salty. And of course, then of course we can't drink seawater. You're faced with either finding another source of fresh water for drinking water, or for example, what they do in areas of California or in Florida, there are desalination plants to desalinate the water. And that's obviously quite expensive, and it's a lot of infrastructure. So as we see sea level rise happening, we're going to worry about things like saltwater intrusion in aquifers.
Very, very interesting. My mind is spinning. I hope that desalination becomes as affordable as solar panels in the future, but we will see. I have one question before we move along. Many of our community members in Carteret County are concerned about issues of social justice and environmental equity. In your assessment, what role does environmental injustice play in the quality of drinking water at this time?
Sure. I think this really gets back to this point I was making of sort of disparities in municipal services available to communities. And so also basically where people live. So just sort of micro environments of social justice associated with localization. So if there are areas that are inexpensive and you have a high concentration of socioeconomically disadvantaged people living there, in some cases that might be because of pollution in the area, say brownfields and other kinds of areas that are potentially introducing groundwater pollutants. And so if those people are also using groundwater wells, private wells, for their drinking water, then you can have a real issue. And actually the whole issue around private wells around not only the state but the country, here's a case where there's really nobody keeping an eye on your water quality other than you. So you have 100% responsibility to watch your own water quality. And most people just don't have the resources to, analyze for, a suite of pollutants. You may never know that you have a water quality issue if you're using a private well. One of the advantages of a municipal drinking water plan is that, of course, they have to comply with the Safe Drinking Water Act. And so there is some check on your water quality right there. When it comes to social justice and environmental inequity, I think it really speaks to the availability of infrastructure for certain groups and not for other groups. And so we really need to pay attention to that.
Yeah, well said. Thank you very much. I will come back to you, but for the moment, we're going to move on to Lisa Smith Perri, who is a manager of the West Carteret Water Corporation. Lisa, I was actually born in Rhode Island, a state with abundant freshwater reservoirs all over the state. Beautiful, beautiful clear water. I noticed that we don't have those here. And I'm wondering, I'm almost embarrassed to ask this question, where does our drinking water come from? I mean, I know it comes from the sky, but how does it get to us?
Well, it takes a while for it to get from the sky to where we actually draw it from. But West Carteret Water gets our water from from wells located in the Croatan National Forest. We placed those there many years ago. In 1986, we started working on an agreement with the Forest Service to place our wells in that location because they would be more removed from the chances of pollution. So for us in particular, we have 8 wells in the Croatan National Forest that we draw from. There are no areas around here. Mr. Ferguson referred to lakes and streams and surface water earlier, but we're strictly well system here.
How interesting. I did not know that. How many times have I had conversations about the forest and never heard about this?
Well, I will say that it was a challenge and remains a challenge to this day to keep these agreements in place. We have a wonderful working relationship with the USDA Forest Service, and we assist them in road maintenance and other things. We have recently purchased, we're located on Highway 24. We are a tree system. We run down the corridor Highway 24 and meet up with almost every other water system in this area. There's a little bit of distance between us. But we've recently purchased the property behind us that is surrounded by Croatan National Forest, and that's the location for our next 4 wells. They will be on private property that
Oh
we
my
own.
goodness.
But the wells vary in sizes. Some of them started off at one size, and because of well rehab or whatever, they have been reduced. But our latest well was a 12-inch, was a 12-inch well that we have placed right at the Croatan National Forest and our property line. And the reason for that being, it was a kind of a unique situation with them, because now one of our biggest concerns is that if we have a problem in the forest, the water has to come all the way out of the forest, down the highway, down to our water treatment plant. If we have a problem, we're cut off from the Forest Service forest area. So we now have a well that is adjacent to our property, and it's our largest producer that we could actually handle serving everyone from that area. But yeah, we are strictly wells.
And could you elucidate for us just how large the area is that you are serving?
We've got 189 miles of water line installed, which I started here in 1986. So when we started off, I think we started off with 42 miles of water line, and that included all the little side streets. So we've actually were built in 5 different phases. And he was talking about, Mr. Ferguson was talking about some of the economic issues and maybe not getting to some areas and building out and around. West Carteret's a little bit different in that we are not a government driven corporation. We are member owned. And so if you need us, that's where we go. We don't push ourselves on you, but if you do need water supply. And so we are located in some of those areas. We are funded by USDA rural development. And so those are really areas that we target. Now we hit everybody else along the way because you've got to be able to pay for this water line as you're going along. But we try to, anybody who needs water, that's really where we target.
Wow, very impressive. And I'll ask the basic question on everyone's mind. Is our water safe to drink, and how is it tested?
Well, we are great advocates for actually touting. We're very proud of our water system and the fact that we have not had those violations, that perhaps, and we did in the beginning. I'm going to tell you, we had an issue with disinfection byproducts in the beginning because one of the offsides to getting water from the Croatan National Forest is there's a lot of tannin in the water. So the tannin created an issue for us, and we have a water treatment plant whereby we now remove color, we soften, and we remove iron. But in the beginning, that did cause some issues for us. And in that planning process of putting that new expanded treatment plant in place, we got a few violations in the early 90s. But we do have we are an approved lab. We do have staff that's all they do all day long is they go out to testing stations throughout our system. They're pulling samples all day long. That's their only job. They come back, they get tested. In addition to that, we like to send samples out to independent labs. So in addition to doing our own sampling, a percentage of those at random go to independent labs and not the same independent lab. So we do everything that is required, and then and above, he alluded to unregulated contaminants earlier. We keep a close eye on those, even though they're not regulated at this point in time. EPA is subject to make any of these regulated. I think, and correct me if I'm wrong, Mr. Ferguson, maybe every 4 to 5 years they come back and they add, or they're looking at information that's coming down the pike, and they may add to what used to be unregulated now may become a regulated contaminant. But we look at it as a whole, the entire spectrum, from the time it leaves our water treatment plant to the time it comes out of the tap. It's not really fair, really, to be quite honest. Once that water tap is placed on the edge of the property, the customer is responsible for their plumbing from that tap to their house. We have no control over what goes on between point A and point B. But with lead and copper, for example, we are responsible for what comes all the way out at the tap. So at least for testing that. So We take a lot of pride in that and make sure that we try to stay ahead of it. If someone has higher lead and copper, issues, we try to educate them on what they need to do. It may be a plumbing issue or whatever the case may be. So each year we send out a consumer confidence report. A lot of systems do not like to send those out. It is a lot of information. If anybody here would ever like a copy, if you're on a public system, you're getting one. You have access to one, but we put a lot of time and effort in showing people every year exactly what we are testing for, when we tested for it, and what the guidance is and where we fell in that guidance. So there are a lot of things out there that we do test for and provide that information to the public.
Very good. Considering a situation, for example, where someone has moved from Minnesota and they've come down to your area and purchased a home and they don't have any idea what the plumbing is like inside of the home, what can an individual family do? Can they take the water out of their tap and send it to be tested?
Are you talking about someone who is on a well and thinking about hooking up? Or
Oh no, hooking up to, maybe they have wonderful water coming down the street, but they're not sure what's going on underneath their own home, what kind of plumbing, if it's lead or copper or old, new, or
Right.
whatever.
Right. Well, they could have a plumber come in, literally dig it up and inspect the pipes for them. When I say dig it up, I'm talking about if they're hooked up from the meter to the house. Most everybody around here uses PVC. There are some homes that do have copper pipes, lead soldered, galvanized. But I would certainly suggest a home inspection if that is a concern for anybody. I do not know what is going on with our local health department right now. I do know that the local health departments would do water sampling for you. And there certainly are agencies out there that would take a water sample. I would be very careful how that sample is pulled and to whom it is sent. But I do not know what Carteret County is doing now, but you used to be able to take a sample to them and they would analyze that for you.
That's very interesting. I'm wondering if this is a rhetorical question, Lisa. If there's a problem with the water, will the filter on your refrigerator clean it up for you?
Okay, I have an opinion about this, so I have to be very careful. It depends.
Okay.
Are you changing your filter as much as you should? You would not believe the complaints that we get about my water tastes bad. How does it taste when you go to the faucet? Well, it tastes fine. How is it tasty when it comes out of your refrigerator? So we do run into that where people they're just not changing the filter the way they should. I do know that there are certain, you've got your Brita filters, you've got, other things. Of course, I'm a tap water drinker because I believe in it. I don't worry about it. It's as safe to me is coming out of the tap. We happen to treat with chloramines, which is chlorine and ammonia mix, so it has no taste or odor. Because of that, our customers are a little spoiled. Those that maybe had a filter or I have one customer who used to have an RO tap right next to her, which is the best that you can get. She had an RO tap right next to her, like a bar tap next to her sink. And she loves our water so much she doesn't even mess with her RO anymore. But 2 months out of the year, we go to chlorine only. And we do that. And when customers start to call and complain and they say, I can taste chlorine, I say, good, we're doing our job. Because we need to get in there and really burn the system and clean it really, really well during those 2 months. So I don't know that I've answered your question. I don't know that I'm qualified to answer your question. I will say that if you're relying on a filter, your water, if you're getting it from a municipal system, your water should be safe coming through the tap to begin with. If you're getting it from a municipal system, if you're trying to take out certain taste or odors like chlorine, sulfur. We have a local system here that when I go to eat at their restaurant, I cannot drink the tea. I just can't. It's not their fault. It's just that they do not have the type of treatment in place whereby they can remove the sulfur from the water. Even aeration is not helping them. So if you're on certain systems and you're having problems with particular items, then I can't see where that type of filtration would not help you, as long as you change the filter as you should.
Very good. Thank you. You more than answered my question. Let me just ask one more before we move on, and that is, what are your concerns for your water company and the service in the future? We all know that a big highway is coming from the Research Triangle. We all expect a greater influx, not only of tourists, but of residents. What are your concerns?
Our concerns are already being dealt with. We, in 2000, maybe 1999, we had an engineer that said, when you get to this, when you start pumping this many gallons of water per day, you need to start doing this. And he was dead on it. And so we are, when we did our last plant expansion, we expanded it such that now we can come in with vessels, and vessels would be the areas where we can remove color, or we can remove iron or whatever. We can just come and insert one and increase our pumping capacity by 500,000 gallons. So when we started seeing, I don't know how many of you remember 2003, 2004, 5, 6, and it started dropping off in 2007. You know, there was a lot of people coming in, real estate was turning over, and that's what we're going through right now. Today alone, we got 7 new tap applications. That means 7 people have applied for us to go out and put a water service in at their house.
Wow.
I have 17 active projects right this moment, 17, ranging from 36 to 350 lots, 17. Right this moment. The bulk of these are on Highway 58. So we've got a couple on the Highway 24 corridor, but the bulk of these are on Highway 58. What I see happening is that we've got a highway, we've got beautiful beaches, we've got a highway that has been improved. I used to go through Jacksonville to get to Raleigh. Not anymore. I shoot up Highway 70 because I saved 20 minutes because of that new bypass around Goldsboro. As we increase our abilities to get to someplace faster, more efficiently, we're going to see people, I believe, visit us more. We have 9,000 customers, roughly. Of those 9,000 customers, if I had to bat around, probably 1,500 to 2,000 of them don't live here locally. They're from Raleigh, other places. They come down just in the summertime, maybe even a bit more. So I think as we make it more convenient for people to come in to visit our beaches, we're going to see our need for capacity to increase, and we can't be stale. We've got to move forward. So for us, we are analyzing how big is our plant. If you think about it as a pie, and we approve a subdivision, how big of a slice of our water treatment plant are we given to this subdivision? And we've got to stay on top of that and make sure that we do not give away resources that we do not have. Right. So that's where we're at right now. We've already got the ball rolling. By the end of 2022, we've asked our engineer to have 2 more vessels in place. The test well for well site number 9 has just been completed. And that's where we're going. I do see an increase. Right now, we are already pumping 400,000 gallons more per day than we did 2 years ago. So that's pretty substantial.
Yes, it is. Yes, it is. Thank you. This has been fascinating. Lisa, I'm going to come back to you, but we're going to move on to Patrick Kelly right now. Patrick represents Carteret County for Public Water. And this group is protesting the sale of the Carteret County's publicly owned water system, which maintains at the moment 1,200 customers. It's being sold to Carolina Water Systems, or that is to say, they won the bid at $9.5 million. The system itself was appraised in 1919 at $12 million. Patrick, could you review for us the history of this sale and of the birth of your organization? Oops, you're muted, Patrick. You need to unmute your, there you go.
All right, sorry about that.
No problem.
So about 4 or 5 months ago, there was an article in the newspaper that the Carteret County owned water system was out for a bid process, an upset bid process. And one of my neighbors posted on Facebook, just the article to Carteret County News Times. And then another friend posted on Carteret or Beaufort and Down East community discussion on Facebook. And I said, well, let's create our own group. We don't need to clog up this chat group. So created our own, and bam. Then we created Carteret County for Water, Public Water. And we have been trying to talk with commissioners ever since. We've had several sit downs with commissioners recently, a few of us for Carteret County for Public Water, and it seems pretty promising, but it's been a big learning curve. You know, none of us are water professionals. We come from all sorts of other professions. I work for the school system. We have people that retired from military. We have people that currently work for cellular companies, retired as doctors, you know, all sorts of different things. None of us had anything to do with water systems. So we all jumped in head first and started researching, reached out to other communities that have been fighting the sale of publicly owned water systems to private systems, started researching. At the onset, it was Aqua and Carolina Water, who were the two in the upset bid process. And you could find a lot about Aqua on the internet, and it took a while to realize that Carolina Water really wasn't a great company either. As we started looking into things, we found that Carolina Water is actually a subsidiary of Corix, and Corix actually is a larger company than Aqua is. They operate in 17 states in the US as well as in Canada. Their headquarters is in Quebec. So as we've tried to explain to the commissioners, one thing we have wrong with it is that the first thing that they're going to care about is their shareholders. They are a for-profit company trying to make money for shareholders. 2, they're headquartered in Quebec. It's not going to be easy for any of us to go to the headquarters if we have serious issues and create a problem. Right now, with the county owning the system, running the system, we can actually find out how to get to every single one of our commissioners' doors and knock on their doors and let them know when we have an issue. However, that's the thing. We don't have an issue with our water. Our water is actually wonderful quality. They go above and beyond what is mandated by the state. And kind of like Lisa said that her customers are spoiled, I would say that we're spoiled as county owned system customers as well. And it's kind of come down to, we're willing to pay more to the county right now until we can kind of figure some other things out, because it will be less than what it would cost for a privately owned company to run the system. Hopefully I answered your question.
I think you're doing a great job. It's there's a lot to know, right? There's just a lot to know. But if I can toss in my 2 cents worth, what I've read in the News Time has done a pretty good job of covering this. One issue is that the county has had to make up for some lost revenue in maintaining the system. However, if I'm reading it right, in 1919, they had to kick in $173,000, but in 2020, they only had to kick in $55,878, which to my mind, number one, it's not all that much money. And number two, there's a huge precipitous fall in the money, in the amount of money that's needed to make up the difference, which tells me that the area is growing. And we know that the area is growing. And if anyone who's driven around the area knows that it already has developments sitting with streets and plots laid out, and it's ready to go. So has that been taken into consideration, that the area is going to, in effect, grow into the water system?
It has somewhat. So it's actually a bit concerning, and some of the things we've talked to the commissioners about. So I live in Shell Landing, and we have neighbors in here who, when they bought their homes in the past few years, even this year, were connected to wells, because most of the homes in here were originally here and on their own private wells. Most of them, I still have a private well that services the outside of my house. County water just services the inside. And some of these new people that have moved in, bought homes, if they just had well water, they didn't even know that there was a possibility to hook up to county water. So the difference in how much the county has put in extra actually has nothing to do with growth, because this system's pretty stagnant, hasn't really had much growth. In fact, they don't do anything to try and grow it. There is going to be growth in Carteret County, and there's some growth that's going to be where this system is. So this system runs on 101, just outside of Beaufort by the airport, down to Mill Creek. So pretty good distance that way. And then 70, right past Food Lion, it runs down to Laurel Road and takes a left and connects to 101. So it's about 58 miles. It should have more than 1,200 customers. There's close to, I think, 3,600 parcels that are on the system, or potentially on the system. So there is room for growth in there, and we've talked to the commissioners about that, how we could get that growth to happen. The system would probably have to expand to get to some more areas that some of the growth is going to happen in other areas off of 101, 70 area and Mill Creek. But really, when you look at the areas that are growing right now, I think it's more on the side of Lisa's operation. Yes. Down 58, 24. People want to be at Croatan High School. People like those schools. There's more land. I think it perks better out there, because a lot of the issue you have with the land that's not developed around here is that it doesn't perk well. So just water service alone won't really help with a subdivision going in. They would need sewer systems as well, which the county doesn't have. Beaufort does, and Beaufort's run out to some areas out here, and that's gone well for some subdivisions and not so well for some others, but that's another discussion, I believe. So I do think there's an opportunity for growth, but I think it's going to take a little bit more. And I do think the commissioners are going to have to look at putting more time into this water system, whereas I don't believe that they have understood what this water system is. And I mean, I know that from discussing with them. They've also had to learn, as we've pushed back, it's created them to really do their homework and understand what's going on with this water system.
Yeah. Good, a learning experience for everyone. Very good. According to the News Times, the next commissioners meeting will be on June 21st, and the sale will be on the agenda with a full discussion and possibly, only possibly, a vote. And that might be a no vote. The newspaper hinted that you were working with the group to make a suggestion of an alternative way forward. Is that correct?
That's correct. So we've been sitting down with commissioners. The first thing is getting the commissioners to vote no. We need 4 commissioners to vote no for us to take those next steps forward. Because the first thing they're going to do is either they're going to keep the system or they're going to sell the system. So we're not trying to put the cart ahead of the horse. We're trying to work on them not selling this system. And then we need to sit down and we really need to look at the books. We really need to see what's going on, see what rates need to go to make sure that the system is self-sustaining, and then potentially look at what our next steps are. Is one of the things we've talked to them about is starting our own co-op on this end of the county to take over the system and take it off of the county if they don't really want it. So there's some things that we're looking at, and we have to really make sure the system's not sold, to start really educating ourselves more on things before we waste our time if the system is sold. But we are hopeful that the system's not going to be sold. We hope as many people as possible show up on the 21st. if you live in the water district or not, it is going to be great for us to have as many people as possible packing that courthouse. The commissioners have told us that. That's the biggest thing to them. If they see how many numbers of people are in the house, it's going to affect the vote. You know,
Okay.
the more people that are going to vote against them, the more that they're going to vote to not sell it.
Very good. So you all heard it here first. Be there on the 21st. Got it. Okay, thank you. Lee, very quickly, I think all of us have read horror stories about water systems in Latin America, for example, being for-profit firms. Is it ever a good idea to have a for-profit water company?
Well, boy, that's a third rail. I don't know that I would say never. I think that the risk that you take with that is that you make sort of, the profit that the private company is not, they have an incentive to basically make a profit. So they have an incentive to have a, maximum amount of revenue and minimum amount of expenditure, while still hopefully, not killing people, right? So, I mean, that would be, I guess, the simple way to look at it. But that doesn't necessarily mean that municipalities and governments are always better, because there's a lot of bureaucracy. There's a lot, in some cases, of ineptitude. And this is true anytime you think about public sector versus private sector. So I don't think it's necessarily as simple as to just say, that it would be, good or bad to have a water system in the hands of private entity versus public.
Very good. That was a very diplomatic answer. Thank you. Good job. Lisa, your water corporation is private, but nonprofit. What is the advantage to the world with that arrangement?
Our money stays with us. So when we start talking about private nonprofits, the fact of the matter is we have to make a profit. We really have to make a profit, but what is defined in the profit? So we don't have a county to look back on. So, okay, we need to replace fire hydrants. We need to replace infrastructure. We need to do upgrades. So the money stays with us. We don't have to fund a police station or some other entity. It stays with us. But at the same time, we also don't have the backup. If something goes wrong, we can't pull from someplace else. So we're a private nonprofit, but we also have reserve accounts that we set aside. So what happens with that is basically the advantage is the money is ours. We regulate it, regulate those funds based on the needs of our membership. Our membership has a say as to what does happen. And, but it's not truly there's got to be some profit in there for you to put money aside in savings to be able to take care of. That's just good planning, 40 years from now, 50 years from now, 60 years from now. So, but the money goes back to the members. It doesn't, if there is an amount that's over and above expenses, which would include our savings and our reserves.
That is so interesting. Thank you very, very much. I'm going to open the floor now. Well, not open the floor, but Lucy Bond has been collecting and collating questions for us. And I will let Lucy ask some of the questions that the audience have placed into the chat. And we'll see how far we get, but I promise that we will end at 8:30. So we'll have 5 minutes.
I think Mr. Ferguson answered some of the questions as the chat went on. He did a good job of that. There was a question about infrastructure, how we've all heard about the problems with infrastructure across the United States. So someone asked the question about the pipes in North Carolina and our infrastructure that carries our water into our homes. So I don't know who would answer that, but that's a good question. I know we did talk about that some, and I know it's part of it's the responsibility of the homeowner, but what about before it gets to our pipes? So
I will say that I believe SWE and some other organizations are identifying systems that are in trouble. There are systems out there, obviously, that do not maintain their systems, and they don't have the funds to do so. I cannot speak to other water systems. Maybe Mr. Ferguson can. I cannot speak to those, but I am very involved with North Carolina Rural Water. I do know that we do have systems that are in trouble, and they have not been maintained the way that they should be. The state is helping with that. They will bring those systems back up to par, but it's going to take time for that to happen.
Yeah, I guess I'd just add on that this is a problem all over the country, and it's not one that's going to be easily solved. I think that there's a few issues connected to the infrastructure. One obviously is quality, water quality. That's obviously of concern. Older infrastructure and older. This is actually what got Flint, Michigan into trouble with lead. But there's other issues, like, for example, with loss of drinking water. So if you have aging infrastructure and the pipes leak, you basically are putting a large fraction of your, well-polished, safe, high-quality water into the ground. And so you don't get out everything that you put in the pipes. And so that's an issue for, basically the economic viability of the process. So I think that this is something that we're just going to have to address, here in the next decade or so. Otherwise, we're going to really run into a lot of problems.
Yeah. So do Morehead and Beaufort have different systems? I mean, are there two different water systems? That was asked.
Yes.
Yes. Okay. I know someone made a mention of Highway 42, I guess, which is your area, and Miss Smith, Perri. But anyway, how was that impact of all of those people coming in because of 42? That's going to, I mean, how much can we safely bring water to people with so much traffic and so many homes coming in?
Each system has a designated capacity. It is going to be on the backs of I think the systems need to work with the counties and the approving agencies. I spoke to we serve 4 towns and a couple of villages. I spoke to one of them today. I said, and I was quite blunt. I'm going to be honest and tell you, I said, you have got to stop approving these subdivisions without finding out what we can or cannot do. From this point forward, you're just going to have to make sure that we're part of that process. The county does it with the TRCs. You're going to have to make sure that we're part of it. And that's just it. We're going to have to work together with the towns, no big I's, no little U's. We're going to have to work together with them to make sure that these farmlands that are being planned out and all of these new lots and everybody that wants to come into the area, let's just make sure that we work together to make sure that we have the resources available to carry them. I don't like over planning. Excuse me.
Good advice.
Yeah.
I think that does it for this evening. This has been a fascinating discussion for me. I still have loads and loads of questions, lots to think about and read about. I want to thank all of our guests most warmly, Lee Ferguson, Lisa Smith Perri, and Patrick Kelly. Thank you so much for being here tonight, and thank you to everyone who joined us. The Dockside chats are taking the summer off, and we will resume with fewer chats in the future, 2 in the fall and 2 in the spring, so that you may attend to other important matters. One of our fall chats will be about plastic, its use and abuse, and one I hope will be about redistricting. I'm working on that. We will be in touch. Please check our website, stay active, stay pumped. We have a big, exciting year ahead of us. Katie, could you unmute everyone so that we can say goodbye?
Everybody will have to unmute themselves.
I see. Okay, if you want to say goodbye, you have to unmute yourself. So goodbye to everyone. Thank you so much.
Thank you
for
very
being
much.
here.
Thank you so much.
Bye.
Bye, Bill.
Really appreciate you.